Hello, I'm Dr. Rupa Ananthasivan and I work as a radiologist in a corporate hospital, Manipal Hospital, Bangalore. COVID has really changed the way we practice medicine, including radiology. There is a misconception that healthcare workers in radiology are far removed from their patient, but that's not true. For every CT or X-ray or mammogram that I report in my room, another healthcare worker, a technician, is in close contact with the patient. Investigations like ultrasound, Doppler, ultrasound-guided biopsies are done in close contact with the patient. So how do we protect ourselves and our patients from the COVID infection? Our hospital, of course, has many policies. Patients are not allowed to enter the premises if they have a temperature. They always have to wear a mask in the hospital premises. Only one attendant is allowed with each patient. Patients are instructed to sit far away from each other in the OPD. As healthcare workers, we are provided with an N95 mask, which we wear at all times in the hospital, particularly when we are in contact with patients. Many of us also wear a face shield, which gives an added protection. Most of us are in scrubs when we are in the hospital, which is easy to maintain. When I am with a patient, I also use a long sleeved gown and gloves for added protection. After every patient and after touching our mask, we always use hand sanitizers to clean our hands, and we clean our hands often and after touching every patient with soap and water too. I keep my procedures as short as is possible. I spend a minimum amount of time in the ultrasound room. There are very few people in the ultrasound room with me when I'm doing a procedure or I'm doing an ultrasound. We usually discuss the results with the patient only after coming out of the ultrasound room. These are for the regular patients who we presume are infected unless proved otherwise. For patients who have proved COVID infection, a CT or an ultrasound or an X-ray is done separately. The patients are wheeled into the CT room separately, separating them from all other healthcare workers except those involved and other patients. We wear a PPE when we are doing investigations for patients with proved COVID infection. We take the ultrasound, we do a portable ultrasound, we take the ultrasound to the ICU and the X-ray machine to the ICU for patients with proved COVID infection. This way, we hope to protect ourselves and our patients from COVID infection, and hopefully we will be successful in this. Thank you.